So in this video we will discuss all the artery of upper limb. Okay. So from the basic of the heart and goes toward the dorsal pedis. Okay. So first of all there is the we will explain the artery. Okay. From artery or from the heart to the right side there is the right brachiocephalic artery come to the right side. Okay. And to the left side and to the left side is no brachiocephalic. They are directly the subclavian artery. Subclavian artery from the left subclavian artery is directly arise from the aorta. Okay, and the right and the right subclavian artery is directly arise from the brachiocephalic artery, and brachiocephalic artery is arise from the arch of aorta. Of aorta. Arch of aorta to brachiocephalic artery and left subclavian and to the left side is directly to the subclavian artery. Now the subclavian artery goes and become axillary artery, and axillary artery goes and become the brachial artery. After the brachial artery divide into two artery. Okay, that is called the radial artery and ulnar artery. Radial artery and ulnar artery. Ulnar artery. Okay, and the radial artery form a after the radial artery. When the radial artery goes, they form a branch. One is the radial form deep palmar arch. Deep palmar arch. Okay, and the ulnar artery form the superficial palmar arch. So this is just like an overview that from the heart to the left, from the heart there is aortic arc. Okay, aortic arc, and from aortic arc there are three. For example, this is aortic arc. From aortic arc there are three vessels come out. Okay, now what is these three vessels? One is the right brachiocephalic. One is the right brachiocephalic artery. This is the right brachiocephalic artery. Another is the carotid artery. Okay, left carotid artery. Another is the left subclavian artery. And from the right brachiocephalic artery, they form the carotid artery, common carotid artery, and then goes toward form the right subclavian artery. And right subclavian artery convert into the axillary artery. Okay, and axillary artery goes toward the goes from brachial artery, and from the brachial artery they divide and form two artery. One is the radial artery to the radial side, and one is the ulnar artery, ulnar side. And radial artery form deep palmar arch. Okay, deep palmar arch, and the ulnar artery form superficial palmar arch. Okay, and they form anastomosis. Are you anastomosis? Anastomosis the connection between two artery or two vein. Okay, now first of all we will explain one by one. Okay, so the first artery is about the axillary artery. Let's come here and we'll explain the axillary artery. Axillary artery. Okay, so what is axillary artery and where is the axillary artery? Axillary artery is actually begin from the first rib. Okay, it is start from the first rib. Okay, begin at the lateral border of the first rib and continue of the subclavian artery. It is the continuation of the subclavian artery, I have already explained, and the lower border of the teres major muscle. It become the brachial artery. When it, for example, this is the axillary artery come here, and the lateral border, this is the lateral border of the first rib. This is the lateral border of the first rib. So from this area, before this is the subclavian artery, and when they form the lateral body of this rib, they form the axillary artery. Now axillary artery, when they reach to the pectoralis minor muscle. Okay, what pectoralis major muscle, teres major muscle, toward the teres major muscle. When the teres major muscle come, okay, at this level this is called the axillary artery. The between this area, this is called axillary artery. Now axillary artery have three parts. Okay, three portion. What that three portion? Pectoralis minor muscle, for example, To this area, the pectoralis minor muscle are present between, and on the basis of this pectoralis minor muscle, axillary artery divide into three parts. First part, this is the second part below the pectoralis minor muscle. Okay, and this is the third part after the pectoralis minor muscle. And each part give two different part. For example, one is the first part, another is the second part, and other is the third part. Okay, first bar first first part give one branch. Second part give two branch, and third part give three branches. Okay, and now we will explain that what are these border or what are these branches. So the first branch that give artery are now on the basis of this first have one branch and second have two branch. Now the first branch is the highest thoracic artery. The that is the first branch is the highest thoracic artery. Thoracic artery. Actually, it is the thoracic artery, thoracoacromial. Now the second branch, second from the second branch. This is there are two branch. One is thoracoacromial artery, thoraco thoracoacromial. Okay, one is the thoracoacromial artery, and another is the lateral thoracic artery. So they give two branches. One is thoracoacromial and another is the lateral thoracic artery. Now the third branch, now the third part. What the third part gives? Third part gives different branches. That is three branches. One is the subscapular artery. Subscapular artery. Another is the anterior circumflex humeral artery. Another is the posterior circumflex humeral artery. Now they give three branches. One is the subscapular artery, another is anterior circumflex, another is the posterior circumflex humeral artery. Okay. Now anastomosis. The subscapular artery and the superficial cervical artery, which are the branch of the thyrocervical trunk from the first part of the subclavian artery. Okay, they form anastomosis with the subscapular artery and anterior posterior circumflex artery, which are the third branch, which are the actually from the third branch. Okay, so but leave anastomosis we will use again. Now this is the axillary artery. Okay, after axillary artery goes on and they form the brachial artery. What? When axillary artery passes toward the humerus, okay, and they form the brachial artery. So we will explain the brachial artery. Brachial artery begin at the lower border of the teres major muscle. You have to remember this. The teres major muscle. When teres major muscle start, teres major muscle. Okay, at the beginning of the teres major, the brachial artery started. Okay, and it is actually the continuation of axillary artery. Okay, enter the cubital fossa. When they enter to the cubital fossa, up to the cubital fossa, there is a cubital fossa. We will explain that in the next video. Okay, and then end the level at the neck of the radius. At the neck of the radius, they divide into radial artery and ulnar artery. For example, this is the neck of the radius. Okay, neck of the radius is this. When this artery reach to the neck of the radius, they divide into two. Artery. One is the radial artery, another is the ulnar artery. Radial artery is toward the radius side. Okay, and ulnar artery is toward the ulnar side. Okay, So they form two artery. One is the radial artery, another, this is the radial artery. Radial artery. Another is the ulnar artery. Okay. After that, they have moves on. They give muscular branches, nutrient artery, the now branch of the brachial artery. Brachial artery is the muscular. One is the muscular branch. They give muscular branches. So, for example, brachial artery right here, the brachial artery, brachial artery. So, the branch of the brachial artery, you have to write it here. One is the muscular branches. Another is the nutrient artery. Nutrient artery. Another is the profunda artery. Another is the superior ulnar collateral artery. Superior ulnar collateral artery. Okay. Another is the inferior ulnar collateral artery. These are the branch of the brachial artery. Nutrient artery supplied to the humerus. Okay. And the profundus artery is actually the large branch of the radial of the actually the large branch of the brachial artery along the radial artery into the posterior compartment of the arm. So it actually profundus artery is supplied to the posterior 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 compartment of the arm. Okay, one is the superior ulnar collateral artery, another is the inferior collateral artery. So superior ulnar collateral, they moves along the ulnar nerve, and inferior ulnar collateral artery, which take part in anastomosis around the elbow joint. Elbow joint, they take anastomosis in the elbow joint. Elbow joint anastomosis. Now this is about the brachial artery. We have explained the brachial artery and their branches. Now after this we will move through the brachial artery, we will move through the radial artery and ulnar artery. Okay. So now come here to the radial artery. Radial artery will be to the radius side. Okay, radial artery. That's why it is called radial artery. So radial artery began at the cubital fossa. If someone asks from you, it began at the cubital fossa. So this is the simple answer. It began at the cubital fossa. It descends through the anterior and lateral compartment, firmly superficial through most of its course. Its middle third or radial nerve, actually it moves through the radial nerve, okay, on its lateral side. For example, if this is the radial nerve, if there are the radial nerve, the radial artery moves to the lateral side of this. This is the radial nerve, it moves toward the lateral side. At the wrist, the artery winds back to the lateral side of the corpus of the proximal edge of the space between the first and second metacarpal, where it passes anterior to the palm between the head of the first dorsal and trochanteric muscle. And another thing is the radial artery form actually the deep palmar arch. Okay, you have to remember this. This is very, very important. Deep palmar arch. Deep palmar arch is formed by the radial artery. How can you remember it? Here is the D. Okay, so it starts from the deep. Another is the ulnar artery, which is actually from the superficial, which forms superficial palmar arch. Now after these branch of the radial artery, its branches. What is the branches? The first branch is the muscular branches. One is the muscular branches. that supply to the muscle that is near to the muscle. Okay, and also another is the recurrent branches of the radial recurrent branches, recurrent recurrent branches. And the third is the, and now what is the third? Third is the superficial palmar branch. Actually, the radial artery have superficial palmar branch. Okay, not arch. It form deep palmar arch. And superficial palmar branch is also present. That form anastomosis with the superficial palmar arch. And the four is the first dorsal metacarpal. First dorsal metacarpal artery. Metacarpal artery. Okay. And the fifth is, you have to remember this, is the artery of the princeps pollicis. Princeps pollicis. Princeps pollicis. Okay, and another is the red artery of the radialis indicis. Artery of radialis indicis. Okay, now this is actually the 6 branches which supply to lateral side of the index finger. Radial artery supply to the lateral side of the index finger. Lateral side of index finger. Now this is the branch of the radial artery. Now deep palmar arch. They form the deep palmar arch. And what is the deep palmar arch? For example, this is the radial artery. The radial artery come here. They form the deep palmar arch. Is the continuation of the deep palmar arch is the continuation of the radial artery. Okay. It actually between the first and the second metacarpal bones at the base of the fifth metacarpal bone. Between the fifth metacarpal bone, between the first and the second metacarpal bone to the base of the fifth metacarpal bone. It forms continuation with the radial artery and it terminates by anastomosis with the deep palmar branch of the ulnar artery. It forms here. For example, if they come here to the superficial side, the anastomosis with the, this is the, there will be the branch of the deep palmar branch of ulnar artery. They will form anastomosis with the ulnar artery by deep palmar branch of ulnar artery. And after that, when they form anastomosis, they form a line. They form a line with the ulnar artery. And ulnar artery form the superficial. They form the superficial palmar arch. Okay, this is simple thing. Now about the ulnar artery. What is the ulnar artery? How it form anastomosis? So first of all, you have to remember that the ulnar artery, it began at the cubital fossa. One thing is, you have to remember it began at the cubital fossa. We will write it right here. Okay, ulnar artery. Now right here, the ulnar artery. Ulnar artery. This is the ulnar artery. And what is the ulnar artery? Ulnar artery form began at the one, you have to remember that it began at the cubital fossa. And it is medially, because ulnar bone is also to the medial side. Okay. And they form the superficial, you have to remember that it forms superficial palmar arch. Okay, they form superficial palmar arch, and their branches is, we will explain their branches. What is their branches? Now come to the branches. The first branch is one is, it form a muscular branches that supply to the muscle. Okay, muscular branch. The second is about the muscular branch, the second is the recurrent branch. Recurrent recurrent branch. And the third is the common introitial artery. Common common introitial artery. Common introitial artery. And the fourth is the deep palmar branch. Deep palmar branch. There are four branches. One is the muscular branch, one is the recurrent branch, okay, and one is the common introitial artery, another is the deep palmar branch. You have to remember that common introitial, many students don't remember that common introitial artery are the branch of the ulnar artery, okay. One is the anterior and one is the posterior. For example, the common introitial artery have, they supply to the introitial, but one is the anterior, that is on the anterior side of the introitial, and one is the posterior, that is on the posterior side of the introitial. And deep palmar branch, they continue and form an anastomosis with the deep palmar arch. Deep palmar arch of radial artery. You have to remember that it form deep palmar continue with the deep palmar arch of the radial artery and form an anastomosis. This is just like a connection between the deep palmar arch and the superficial palmar arch, okay. Now another thing is the common introitial and another is recurrent branches, which take part in the arterial anastomosis around the elbow. Recurrent branches, these recurrent branches actually form anastomosis. They form anastomosis connection with the they form anastomosis with the actually with the around the elbow joint. Arterial anastomosis. Arterial anastomosis with the elbow joint. Elbow joint. Okay. So they form anastomosis with the arterial anastomosis around the elbow joint. This is actually all about the ulnar artery and their branches. Now we will explain the superficial palmar arch. What is the superficial palmar arch? For example, the ulnar artery come here, they form a superficial palmar arch, okay. When just beneath the palmar aponeurosis, this is actually just beneath the palmar aponeurosis, and the long flexor tendon, it is the continuation. This is the ulnar artery, so the superficial palmar arch is the continuation of the ulnar artery. You have to remember this. Now the branches of superficial palmar arch. What is the branches of superficial palmar arch? Digital artery supply for medial finger. Actually, it's supplied to the, its branch is the digital artery supply. Digital artery supply. Actually, it's supplied to the digit of the arterial for medial finger. For medial finger, okay. Not all finger. For medial finger, okay. So we have spent all the things of here. Now another thing is there is the, you have to remember that ulnar is the superficial. Ulnar have superficial because here come u, and u mean superficial, u mean ulnar artery. Superficial formed by the palmar arch is formed by the ulnar artery, and deep palmar arch is formed by the radial artery because it come d, okay. It u and here d. So just like you have to remember like this anastomosis, like this, okay. Now we will explain the vein of the upper limb